When the COVID-19 outbreak began, the virus hit Black and brown communities hard with unspeakable losses. Since April, the Michigan Coronavirus Task Force on Racial Disparities has been working to eliminate the impact COVID-19 has had on communities of color. Led by Lieutenant Governor Garland Gilchrist, the task force includes individuals from doctors and public health experts to community organizers. They've made progress by making testing more accessible for communities of color, which includes drive-through, walk-up, and mobile testing sites. They've helped people find primary care physicians, handed out millions of masks, and reminded people to wear them through aggressive marketing. And they also recommended implicit bias training be a requirement for all medical professionals. The data showed early on it was working, but now that cases are going up, will this be enough? I asked that question to the Lieutenant Governor.
So do you think the recommendations that the task force has made will help Black and brown people fight off a possible second wave of infections?
I think the recommendations that we've made will continue to need to be implemented as they have been, and as the seasons change. We recognize that we still don't have an antiviral treatment. We still don't have a vaccine. So that means we all still need to be vigilant and be careful. What we have seen is that as these numbers have begun to inch upward in Michigan, the disparities have not returned, but we cannot rest on our laurels.
We've done news stories where people have said the hospitals or doctors sent my loved one home to die in their recliner because of implicit bias. Have there been conversations amongst the task force in terms of how we combat implicit bias and put an end to it?
And because we didn't have enough tests, we literally didn't have enough tests. So medical professionals were put in this impossible situation where they had to choose who got tested and who did not. And when you have a choice point like that, implicit bias can impact how you make that choice. And so one of the first actions that the task force took was through Dr. Khaldun writing a letter to every medical professional in the state of Michigan, naming that implicit bias may be present in testing and treatment decisions when it comes to COVID-19. And letting them know that the research to deal with implicit bias, like step one is naming that implicit bias may be present. And then that is how you begin the road to deal with it. We've actually gone much further with that, again, showing some leadership here around the country and doing two additional things. One is we have, through executive directive, called for every state employee in Michigan to undergo implicit bias training, including me, including the governor. I took it. It was actually quite eye-opening. And the second piece is that we have begun the rulemaking process to make, as part of the requirements for obtaining a medical license or renewing a medical professional license, that medical professionals would have to have implicit bias training.
How are you doing after losing 23 people this year? And I mean, this is deeply personal for you.
Look, I was receiving calls or text messages on a daily basis in March and April and May. Somebody else got sick. Your old basketball coach passed away. The associate pastor of the church I grew up in passed away. The eldest member of my family on my father's side passed away. For me, this is about the fact that I believe so much of this was preventable. I believe that our national failure has led to these 23 goodbyes that I've had to say. It has led to the thousands of Michiganders that have had to deal with virtual funerals to say goodbye to people in a way that we have not ever had to mourn in this way culturally. I was moved, as so many thousands of people were, by the memorial that we had on Belle Isle, where I went and saw, many of the pictures of the faces of people who I've lost personally to COVID-19. So for me, I tried to find my way as a public servant to, one, be empathetic, because I'm not the only person, obviously, who has lost people to this virus, and to try to channel that as motivation to make sure that we can lose fewer people going forward.
And just a quick note, the task force also recommended the governor declare racism a public health crisis in the state. You remember that? Well, the lieutenant governor says what that did was give every state department permission of sorts to revisit their policies and the impact of their policies. And he says once you can name something, quantify it, then you can have the conversation about what real reform looks like.
And Lieutenant Governor openly sharing his loss of 23 people to COVID-19. His experience, like so many other Detroiters who've lost too many people to this virus. The Detroit community is still mourning, wanting all of us to take this seriously, and a few of those families shared their loss with us.
Just her smile, just just her. Yeah, just her smile. Yeah.
You know, it's still hard for me to figure out life without her. Hard, you know, incredibly sad. I miss him like crazy.
Some days I can deal with it, some days I can't. I mean, it gets emotional.
He had a laugh that was just, that'll fill up a room. You know, like I hear his laugh still because it was that special. My father went to the hospital that day. He had a fever of 102, shortness of breath, coughing, diarrhea, vomiting. He had all the signs that the TV is telling people to come to the hospital for.
His cuticles are now blue. He has chills so bad, he's just cold to the bone. So my son gets him ready to go to the hospital. He turns to leave. I said, I love you. He says, I love you too, baby. I said, call me. He didn't say anything. I said, call me. And he turned and he looked. And he nodded his head. And that would be the last time I saw him.
She just ran out of energy. She didn't have any energy. From then on, she was on a ventilator for 3 weeks, fighting for her life for 3 weeks. And I was here alone in quarantine, you know. So for 3 weeks, I was home, you know, in agony.
It made it rough to not be able to be there to see what was going on, to talk to her to see if she was getting proper care or if she was getting better or not.
It's very difficult to say what was or wasn't done because we couldn't go.
I never envisioned my wife not being here with me.
Without the proper treatment, it killed him. Killed him at home next to his wife. My mom woke up and found him. My brother ran upstairs and found his father dead in the chair because he couldn't get into the hospital.
I was tormented. Yeah, really tormented. Yeah, that was like the worst time of my life.
2020 is a year that I wish we can just erase.
Mom's not coming back. I mean, there's been several times where I've dialed her number just hoping she would pick up. There'll be times where I ride past the house and I want to go knock on the door. What I say to people that think this is a hoax, I mean, I hope and pray that it doesn't hit your family because it hit my family hard.
I know countless people who lost their life to COVID. You know, this virus is real. This virus is real. Stay protected.
This is a real threat to your life and people that you love life. I'm a real person, sitting here devastated that my husband is no longer here. Very much real, very much real, very much real.